ولكن أرى أن الذين يدخلون يقفون ولا يقعدون، فهل هم لا يشعرون بالملل من؟ أما ثانيا فأقول الضحى أومض بالسنل والضاحي، فاملأ فؤادك من رحيق الأقداح، واسعد بمرأى الورد في جناته، واهنأ بأنغام من الصباح. وواحدة من أنغام الصباح سمعتها الآن، فهي أنغام جميلة كل واحد منا قد وضعها لنفسه في موبايله لكي يستمتع بالرنة حينما يكون خارج القاعة. ولكن أنغام الصباح ورنات الموبايل إذا ما عزفت مطربة مغردة في وسط القاعة ونحن في محاضرة علمية فسوف تؤدي إلى النتيجة المعكوسة، فيرجى وضع الهواتف النقالة على الصامت. وشكرا جزيلا. تعلم فليس المرء يولد عالما، وليس أخو علم كمن هو جاهل، وإن كبير القوم لا علم عنده، صغير إذا التفت عليه المحافل. تبدأ الآن الجلسة العلمية الأولى. أدعو رئيس الجلسة الدكتور خضير حزبر الأسدي لترأس الجلسة، وأدعو أيضا مقرر الجلسة الدكتور أحمد أسمر فليتفضلا إلى المنصة مشكورين.
السلام عليكم ورحمة الله وبركاته. على بركة الله هذا والموسوم بالكشف عن السن ومعالجته وعلاجه، وكان بودي أن نرى في العنوان الوقاية منه أيضا. We have 1 hour for presentation. We have 6 presentations. We are speaker factors associated with relapse of tuberculosis patient by Dr. Sulaiman Dakhil, and we have to stick to the time, please. 10 minutes for Dr. Sulaiman to present his talk.
The title of my thesis is Studying the Factor Associated with Relapse of Pulmonary Tuberculosis. Antiquity, what were almost related.
40 years ago. Relapse defined by the recurrent tuberculosis at any time after completion of treatment and apparent cure. Recurrence of tuberculosis may occur either as a result of relapse infection due to the same Mycobacterium tuberculosis strain or due to exogenous reinfection with a new strain. In the setting with high incidence of tuberculosis, exogenous reinfection is more likely to account for recurrent disease than in the setting with lower rate of tuberculosis, where recurrent disease is more likely due to relapse. Most relapses occur within the first 6 to 12 months following completion of therapy. Among patients treated with rifampicin-containing regimes using DOT, relapse generally occur with susceptible organisms. For other patients, the risk of acquired drug resistance is substantial. If the initial drug susceptibility testing was not performed and the patient failed or relapses with a rifampicin-containing regime given by DOT, there is a high likelihood that the organism were resistant from the outside. The aim of study. The study the factors associated with the relapse of pulmonary tuberculosis in Iraqi patient after full course of anti-tuberculosis drug. Patient and method, a cross-sectional study has been done in the chest and respiratory disease teaching specialized center in Baghdad during the period from the 1st of January 2010 to the 30th of July 2011. A total of 58 patients with treated pulmonary tuberculosis were studied for relapse. All were recruited from outpatient department, completed first-line regime following DOT program. Patients were included in the study was first-time relapse, a case diagnosed by positive Nelson stain of sputum showing acid-fast bacilli for more than 1 time with sign and symptom of active pulmonary tuberculosis, with radiological findings supporting the diagnosis. For each age, gender, marital state, regularity of treatment, diabetic mellitus, alcoholic intake, and prison has been studied. In the second diagram, it's according to the gender. We note that 78% of the case it is usually male and 22 is female. The discussion above talking regarding to the previous diagram, and we found male-to-male ratio is 3.5 to 1, while the association between male sex and relapse has been reported in only one published clinical trial. 2 other studies show no significant association between sex and relapse. We found also that the vast majority of relapse cases were married. Others show the married cases has a higher percent of relapse also. In our result, we found there was no significant influence of treatment regularity on relapse, and alcohol ingestion is significantly associated with male gender among relapse cases. Other studies show that the non-adherence is a strong risk factor for recurrence of tuberculosis. Also, they found significant association between alcoholism and the relapse of pulmonary tuberculosis. It was significant to find diabetic cases contribute to about 1/4, 25%, 25.9% of cases. Others showed that relapse was significantly associated with conditions predisposing to active tuberculosis, among which diabetic mellitus was the most common. History of presence significantly present in the 29.3% of cases, while others obtained no significant effect of presence incarceration on relapsing. There was no significant influence of smoking on having relapse. In others, there is a significant effect of smoking on the pulmonary tuberculosis relapsing. Another study shows there was a significant influence of smoking on having relapse. Conclusion and recommendation. Recurrence of tuberculosis was more common in the male, married, diabetic, prisons, and alcoholic patient, and patients presenting at least one of these risk factors can benefit from the implementation of the post-treatment surveillance system for early detection of recurrence. We advise to early detection and good control of diabetic state, also with good education and follow-up of the presence for early detection of pulmonary tuberculosis and treatment. Also, there is advice for alcoholic abstinence. Thank you very much for your listening.